diet, the actually like the illness, they probably came in to get checked out. And she actually acted as a therapist for a lot of her patients because many people actually were suffering from depression or substance abuse. So she would try to talk to them and figure out what's going on in their lives to figure out kind of what was causing that, like those things, and how that had to do with whatever illnesses they also had. And so along with the elderly patients that I got to see, there were a lot of people who, it actually interested me how many people weren't really involved with the financial part of their medications and treatments, and then how many were really concerned about how much things cost because they might not have the proper like medical insurance. And it was interesting to see like the stories behind the people who couldn't afford what Dr. Nolte was prescribing them. And some people were actually worried about simple blood tests and things like that that usually no one would really think would be that expensive. But there was actually one man that came in, and his story really interested me because he worked 3 jobs, and it was like in basements, attics, like helping repair and clean out people's houses. So he was always on his knees, making his like joints hurt, dust getting in his eyes, like hurting his vision. So he ended up needing glasses, and Dr. Nolte was really telling him, you need to go see a specialist, or at least go to the store and get like some prescription, or not just like regular reading glasses. And he said that he could not afford it because all of his money actually goes to his family who lives a couple states away, who doesn't really get to see. So all of his time and money goes to supporting his family, and he doesn't really get to, I guess, do anything for himself, and he doesn't really get the medication and treatment that he needs. And I was also very interested in how Dr. Nolte and her practice, they are partnered with, I don't really know the name of it, she never gave it to me, but it's a facility that helps teenagers transfer from the juvenile detention center back into the real world. So it's like a middle place where they can kind of get back into things. And a lot of the patients from there actually came to her asking her to help them stop smoking, which I was really interested in that because it was cool how they really wanted to better their lives as they were transitioning back into the real world. So while I was not with Dr. Nolte, I was sitting out with the nurses. They're all at lunch in this picture, so I wasn't really able to get a good picture of all of them. But I would talk to them, and one woman actually sparked my interest in my big question for my research paper. And we initially talked about childhood vaccinations and how effective they are. And she, as a child, did not get vaccinated for I don't think anything that she was supposed to. And so she ended up getting very sick during her teenage years, and she spent about 2 years of her high school career in the hospital, at home. She wasn't able to do anything like other people were. And even today as an adult, she still will have to stay home from work weeks at a time because she's still experiencing symptoms from the illness that could have been treated if she had gotten vaccinated as a child. So that led to my big question: are childhood vaccinations beneficial to a patient's long-term health? And throughout all of my research, all the case studies that I looked at, it definitely was more beneficial than natural immunization. And especially during the first few months of infancy, it's better to get your child vaccinated because they are more easily able to create antibodies that can fight against the illnesses that will attack them at that early age when their immune system isn't quite ready to tackle them. So basically, it's more beneficial than waiting for your child to naturally gain immunization. And
Kylie Ashton, please come to the front office. Tyler Marks, Abby Mead, please come to the front office. Tylee Ashton, Tyler Marks, Abby Mead, please come to the front office.
Okay. Well, basically, after my internship, I didn't really get to work with children as much as I'd like, and I decided to take my community service and make that more of an, I guess, hands-on thing where I could actually work with children. And so I decided to do my community service with Central Elementary School. And there I got to work in the nurse's office, and they were really excited to have me because usually the elementary schools get teacher cadets who like to help the teachers out, but the nurses never get any help. So they were really excited, and they, as soon as I got there, they shoved a bunch of paperwork in my face. And so I sat there and I'd have to go through people's files and like check if they passed their vision test or hearing tests or standard things like that. My mentors were Sonia Patterson. She's actually the head nurse of all the public schools in Savannah. So she goes around, her main office is at Central, but she will travel to each one as needed. And then Joyce Houchins, who actually works specifically at Central. Both of these women were actually really fun to get to know. They told me I could go hang out at the nurse's office anytime I wanted, even if they didn't really have a lot of work for me to do. And Sonia actually was allowing me to help her with vision tests, which normally it would be like the chart with the letters and you read off the line to make sure like you can see. And for elementary school students, they actually use charts with pictures instead of letters, and so they have to say if it was a circle or a flag, or some things like that. I just have to say if they clearly saw the images or if they kind of got close to it or not at all, and I've had to report that in their files. So for my legacy, I decided to tie that into my community service. Miss Patterson is planning on helping me try to get materials for first aid kits donated to at least one of the schools in Savannah to give to each teacher to put in their classrooms so that they have the proper materials to deal with emergencies such as like even as simply as a paper cut that ends up bleeding, like with gloves they can put on, antibiotics, bandages, just things like that that they don't really have a lot of in the nurse's office to begin with. So teachers usually don't get these necessities. So next year this year in the fall, I'm actually attending BCU, and after my internship, I still hope to apply to their nursing school after about 2 years and kind of go into helping out the people who can't really afford the medical care that they want. That's really what I was inspired by throughout my entire project, because I didn't really think I would like my internship as much because there weren't any children. But I actually was really inspired by the fact that there are people who don't get enough like support and help with their medical care. So I really want to get into that in the future. Advice to the upcoming seniors: definitely make time for your project. I am usually like a really busy person. I play fall sports and I do dance. So I had a really hard time making time to go to my internship in community service, and I ended up having to leave school multiple times, and the attendance office was not very happy with me at all. So you really get out of this experience what you put into it. So you need to make time to go and learn from your mentors.
Have you looked into a pediatric nurse practitioner?
I actually have. I'm hoping to go to BCU and complete their 2-year nursing program and possibly go farther to become a nurse practitioner. And depending, I know in the nursing education field, you have to go through each field just to get experience throughout like the whole thing. So I still, as of now, would plan on going into pediatrics, but just throughout the experience, I'll open my mind and see if I like anything else better, but as of now, that's probably what I'd end up doing.
I think with all the stuff about,
Marks, please come to the front office.
I think all the research they have now about vaccines is really fascinating, especially like that original study that linked it to autism, since it's mostly been like since then by almost every study that has looked at it since then has been completely debunked. So like, but you still see in certain places like California a trend towards not vaccinating. Like that's why we're getting like measles and enterovirus B68 in California. So like when you're doing research, like what do you think is the best way to combat that trend towards not vaccinating?
I definitely think vaccinating is probably the best option, but I know a lot of people with like their religion or just like their personal beliefs, they choose not to.
Right.
And then you just have to, I guess, monitor your children, keep them from getting into situations where they'll be susceptible to a lot of germs and things from other